Dyslexia is a disorder that affects a person's ability to read, write, and spell. It ranges from mild to severe, and it's a lifelong condition. Dyslexia often runs in families, meaning that genetics are involved. Neuroimaging has shown that the areas that should be active in the brain when we read and write do not function properly in people who have dyslexia. Although dyslexia does not affect a child's intelligence, children with dyslexia will often struggle in school. They may be incredibly creative and great problem solvers, but still struggle with the fundamental skill of learning to read and write. Because of this, these children may feel like they're less smart than their peers, and their self-esteem can really take a hit. If you notice that your child reads and writes slowly, that their spelling is inconsistent, that they may be able to follow verbal instructions but really struggle with written information, or are just struggling more than their peers when it comes to reading and writing, then you should talk with your child's teacher about your concerns and seek the help of an educational psychologist, a speech therapist, or a reading support specialist. While we cannot cure dyslexia, there are tools and strategies that we can use to help people learn to read, write, and spell better at any age. And we know that the earlier we intervene, the better the outcomes. One of the tools that I like to use is the Forbrain. Forbrain is a wireless altered auditory feedback device. It has a microphone, a dynamic speech filter, and it uses bone conduction to stimulate the auditory nerve directly. When we wear it, we can hear ourselves in real time, but slightly louder thanks to the bone conduction. This effect of hearing ourselves slightly louder makes the things that we're saying easier for the brain to process and remember. So for some children with dyslexia, this can lead to an improvement in recall of sight words, which can help with increased reading fluency. Forbrain is designed to be a complementary tool, made to be used alongside other evidence-based practice methods like Ord-and-Gillingham or multisensory approaches. When I introduce the Forbrain to a child with dyslexia, I like to first show them how it looks on me before helping them to place it on their head. I aim to keep it on for about 10 minutes per session or for as long as the child wants to keep it on for. And I like to use it for 3 distinct parts of my session: for practicing sight words aloud, for reading passages aloud, and for spelling aloud. Forbrain is a tool that you could also use at home to give your child an extra boost. You could start by using it for 10 minutes a day in activities that your child is already doing, like during homework, reading stories, or practicing their sight words on flashcards. Forbrain can be a great complementary tool to use alongside the support of an educational psychologist, speech therapist, or reading support specialist. In my practice, I've seen that children seem to enjoy wearing the Forbrain and seem to have better recall of sight words and increased reading fluency. And when it comes to dyslexia, every little bit helps.